Yeah, just let me know if anyone's in the chat. Okay, so today we're going to be talking about health disparities and health outcomes for Black patients and other minority patients. We're going to be talking about the social determinants of health, how those can be addressed. So yeah, that's mainly what we're going to cover today. So yeah, health disparities are basically poorer health outcomes for specific populations. So specifically for minority patients, they're at risk for poorer health outcomes. So they're at high risk for high blood pressure, for diabetes, for stroke, for cardiovascular disease, for maternal mortality. So obviously all those are bad things and kind of make it harder. They decrease your quality of life and they also decrease your lifespan. So a lot of work goes into seeing how can we kind of alleviate these, looking at why do Black Americans have higher blood pressure, what's going into that, because it's not just happening just because. It's not just because of race, it's because of other factors. So a lot of people will talk about how a certain race is at higher likelihood for getting a certain disease, but it's not really just because they're Black or they're white or whatever. Most of the time it's because of racism and the structures that go along with that. Okay, so we're just gonna do like a 30-second brainstorm of what factors impact your health before and after you're diagnosed with an illness. So what could increase your likelihood to get an illness, and what could make it harder to live with that illness or easier to live with that illness. So yeah, just take 30 seconds. And then if anyone wants to share out, they can. Your environment. Okay. So yeah, your environment. So a lot of things can come into play within your environment, whether that's well, we'll get into that more later. Scientists will talk a lot about nature versus nurture, which is basically your environment versus your genetics. So like some diseases are highly linked to genetics. So there's a gene that increases your likelihood for breast cancer. So that's obviously highly genetic. But most diseases and illnesses are a mix of genes and environment. So we're going to be focusing on mostly the environment today. So that's kind of your social determinants of health. What is your environment? And that's not just your physical environment. That's also your economic status, your education, your nutrition, your community and social context, and then your healthcare. And we're going to kind of break down each one of these and talk about how they impact your health. So economics and health, it obviously impacts your ability to afford treatment, and it impacts your ability to afford basic needs. And the big thing is it overlaps with most other social determinants of health. So it's not like cancer is biased towards people who are broke. It's because of how your economic status interacts with other things. So obviously your education and your health. So education can impact your economic standing. Obviously people go to college because they want to improve their economic standing. And then it also impacts your health literacy. So for someone who was only able to finish high school or not able to finish high school, it would obviously be harder for them to have a greater health literacy. And then that would impact their lifestyle choices and their overall health outcomes. So we'll talk more about health literacy as we go through this. And then obviously nutrition is a big component of your health. People always say, make sure you're eating healthy whenever you're trying to avoid illness. Obviously, it's not the only thing that impacts your health, but if you're unable to access food or unable to access affordable food or unable to access healthy food, then that's going to be a big issue. And this is specifically impactful for communities of color because grocery stores aren't available in the same areas. So if you go to a lower income community, it's more likely that you're not going to have a grocery store. You're more likely going to have like smaller convenience stores like a Mr. Pantry or Save a Lot, just smaller stores that don't offer the same variety of healthy foods. They may not have as much fresh produce. So it's going to be harder to have a balanced diet if you don't have access to the healthy foods. And a lot of grocery stores are built for people who have cars who are able to travel to the grocery store. And even if you do live in a close-ish radius to a grocery store, obviously, if you don't have a car, like college students, you can't just buy a whole month's worth of groceries because you have to worry about transporting it. So nutrition is obviously a big factor in health. And then your community and social context. Oh, your community and social context. So your support systems are big, and it may not be as clear when you're just thinking in general. But if you think about, let's say, sticking to your medication. Let's say you're very forgetful. If you have someone in your household who's able to remind you to stick to your medication, or who's able to help you get to appointments, obviously your community is very important in keeping up with your health. And then also the social context within which you live. If you're a person of color, if you're a woman, if you're a part of the LGBTQ community, obviously you're exposed to different discrimination, and that leads to different stress, and stress can obviously have a harmful impact to your health. And then, so of course, healthcare is a part of your health. If you're not able to access healthcare, then you're going to have poorer health outcomes. So a big thing is whether you have insurance. And then if you do have insurance, are you like fully insured? Are you underinsured? Because if you have insurance, but it doesn't really cover anything you need, like it doesn't cover your medications, it doesn't cover trips to the doctor you need to see, that's not really going to be very helpful. And then if you have large copays, even after you've paid your premium, then it's going to be an added stressor, and you're still not going to be getting the care that you need. Also, proximity and availability of providers. So this is really big in rural areas. So if you're farther away from the city, you're going to have less healthcare providers out there. You may not have the specialists that you need to see. So you're going to have to find transportation to where you need to get. So yeah, especially in rural communities, proximity of providers is not as high as it needs to be. And then what are the factors that can impact your quality of care? There can be bias and discrimination at play. How many of you guys have gone to the doctor and you felt like your concerns weren't heard? So yeah, a lot of times for patients of color, they'll go to the doctor and they'll have to exaggerate their symptoms, or they just won't be heard by the doctor. So that can cause issues. Along with the higher rates of cardiovascular disease in the Black community, they have lower rates of referral to cardiologists, and cardiologists can provide that extra level of care and oversee their treatment plan better. So when you're not being referred to a cardiologist, it obviously hurts you in the long run. And then your physical environment and health. So sometimes this won't be as thought of, but everybody's familiar with like the Flint water crisis, where they weren't able to have healthy drinking water. And that's not an anomaly in the US. That's very common. Many cities are going through that, and it's disproportionately affecting communities of color and poor communities. So that's just one way you can be exposed to toxins, whether that's in your water and the paint in your house with lead paint. And then we're going to watch a video in just a second that gives another example of how the physical environment can play into your health. And then some other things. So your ability to exercise. Doctors will stress, make sure you're eating right, make sure you're getting out there and getting active. But if you don't have parks in your neighborhood, if your neighborhood isn't very walkable, there are no sidewalks, if there are no playgrounds, or if you just don't feel safe in your neighborhood, it's going to be very hard to get that exercise that is recommended. And then availability of transportation is obviously important. If you need to get to excuse me, if you need to get to an appointment, you're going to have a lot of trouble if you don't have a car, or if there's not like a public transportation system that you can easily access, whether that's because you're just not in a bigger city that has like a subway system or a good train system or bus system, or whether you're in a rural area that just doesn't have that transportation to the providers you need to get to. And then, of course, stability of housing. It's hard to take care of yourself if you're not able to take care of your basic needs. Housing is right up there with one of the most basic needs. And it also plays a part in your entire physical environment. Where you live affects the transportation that's available to you. It affects the safety of your environment, and it affects your exposure to toxins. So we're going to watch a quick video. And this, I believe, is of Jackson, Mississippi. Let's see.
A community more affluent people. This would have made headlines 20 years ago when I first started doing the work. The reason that the situation has continued for so long is because of the type of benign neglect that has happened to Black communities, poor communities, and rural communities across the United States.
What I have witnessed this week is not benign. It's horrible.
It is horrible, but the neglect is obvious. That somewhere along the way.
Oh, I'm joining that thing I couldn't go to in person on Zoom.
In terms of who should have access to sanitation and who shouldn't.
Why did you choose to focus on this?
Don't close the door.
Because it's so
Try it when you do that. The door was
No,
open when you came in here. It can stay open.
So we all should have access to sanitation.
Get the tacos!
It's not sexy, the media is not going to be interested in that.
We should go get the tacos!
But somebody has to do it.
So the house was right here?
Yes, the house is right here.
Flowers knows about this problem firsthand. The 63-year-old took us to the site of her childhood home.
When we first moved to Lowndes County, we didn't have indoor plumbing, we had an outhouse.
She says this fight is about basic human rights, a long tradition in Lowndes County. The march from Selma to Montgomery passed through here. Flowers' parents registered Black voters. Their home was a meeting place for civil rights activists. Did they encourage you to speak up when you saw something wrong?
You know, when you grow up in a situation where your parents are constantly speaking up, you don't learn to be quiet. So, now Dante, what's your last name?
To make sure the voices of the marginalized are heard,
I'm Audrey.
Flowers founded the Center for Rural Enterprise and Environmental Justice. She has testified before Congress,
Rural communities should no longer be left behind.
brought in politicians, anyone she thinks can help. The state doesn't know exactly how many people have this problem. So Flowers went door to door in Lowndes County to try to find out.
Of the 3,000 or so.
Can you unmute the? All right, so essentially they have sewage backing up into their backyard. So every time they go outside, they smell, or even when they're in their house, they're smelling the sewage system that isn't properly functioning. And then that's exposing them to toxins every single day. So that's just one example. And obviously that's a poor Black rural neighborhood where they don't have access to a safe environment. And then that can lead to future poor health outcomes. So, okay. So kind of thinking back on the social determinants of health and that we've talked about, your economic background, your physical environment, your education, your nutrition, your social environment, and the healthcare that's available to you. We're going to do like a mini case study and just think about how you would address this issue. So you're an emergency room physician at Wexner Medical Center, and you're in your third year of residency. Because of the COVID-19 pandemic, you know it's important to utilize the ER only for emergencies to avoid unnecessary exposure to COVID. However, you continually see the same patients come in and out of the ER for non-emergent concerns. So concerns that really shouldn't be taken care of in the emergency room. How would you address this?
Anybody? I know some of you guys work at the hospital, so you guys probably have seen it. I would probably just see what they're on. Depending on that, you would probably get them a social worker. That's who can best help them with their concerns. If it's like home life, they don't have housing, they don't have food. That's one step network that around the city.
So basically reach out, I'm just repeating it so they can hear us in the Zoom. So reach out to social workers so they can work with the patient to figure out kind of what's going on. What's their social situation like? Are they in need of housing? Are they in need of food? What's going on?
Since Wexford is a public hospital, you can't. That question.
So yeah, we have a question in the Zoom. Wouldn't you just not admit patients who didn't have immediate concerns and refer them to a nearby urgent care? Well, yeah, at a public hospital in Wexford's emergency room, they have to see you. They can't just send you away. They can try to fast track you and see you quickly, but they can't just see you away. They have to take you in and examine you. So that causes some issues. What was your name? Yes. Can you say that one more time? Omema. So like you were saying, it might be good to kind of address the situation, what's going on with them. In the emergency room, a lot of times patients will come in because they're homeless and they don't have anywhere to go, or because they just don't have access to a primary care physician. So if you have just a regular thing, like let's say you're having chest pain, or chest pain is kind of emergent. Let's say you're having a sore throat. It's been going on for a few days and nothing you do can really help it. If you don't have access to a primary care physician, if you don't have insurance, then your only option is to go to the emergency room.
I know it's very important, just like how you said, to get a higher up or else things will get aggressive. I don't know if you've experienced that too in the hospital, where it's just best to, you know what I'm talking about. So it's just best to get a higher up. Don't even deal with it. Get a social worker. That's why there's people there. So to keep yourself safe, I know a lot of you guys are in clinical experiences in the hospital. So don't ever go back and forth with the patient. Just get the nurse manager, clinical manager, get somebody to help you.
Yeah, so you definitely don't have to go it alone, and just understanding their situation, kind of what is the reason that they keep going into the emergency room. Because this is a real situation. You'll see the same people come in and out. And if we don't address what's actually going on, like what's going on behind the scenes, then you're going to keep having the same issue. And obviously right now it's important to keep the ER empty, or not empty, it's never going to be empty, but try to keep it from getting clogged up, because it is a risk to go in there and maybe contract COVID. And there are just a lot of people sitting in there waiting for treatment.
Also, sorry, just remember to advocate for minority patients as well. I've seen a lot of times in the hospital, especially there's that one, Black patient that keeps constantly coming back. It's like, oh, it's whatever. But at the end of the day, something probably is wrong with him or her. So it's best to advocate for your patients as well.
Yeah, definitely. Another concern could be maybe the first time the patient came in, they just didn't have their concerns heard. They thought something was wrong and the doctor was like, oh, everything checks out. So they go on their way, and a couple of days later, it's still going on. So they come back. They still can't get any help. So yeah, a big thing is patient advocacy, and we're going to talk more about that later. We have a couple slides on that and how you can kind of support your patients to make sure they're getting the help that they need. Okay, so we have another case study. So you're an attending primary care physician at Wexner Medical Center. You've grown frustrated with one of your patients who was recently diagnosed with type 2 diabetes because they have missed 3 consecutive appointments. When they finally return, they have not filled their medication that you prescribed for them for their high blood pressure, and have not made any lifestyle adjustments to combat their type 2 diabetes. How would you guys respond to that?
Future physicians, how would you respond to that? Yeah, go ahead.
Once you can have access to transportation.
Sorry, I can't hear you.
Oh, sorry. I was saying, I would check to see if they have like reliable transportation to get to appointments.
Yeah,
Yeah, that's a great point. So just checking to see if they have transportation to get to their appointments, checking to see if they have transportation to get to the pharmacy. And there are services if you're a physician and you find out, oh, this patient can't get to their appointments. It's best to address that as early as possible, so they don't have poor outcomes, like their blood pressure goes up, their blood glucose goes up, and they're just not getting treated. So it's best. Yeah. So obviously, the longer health problems go untreated, the worse they become. So it's best to address what's going on behind the scenes as early as possible so you can effectively do your job as a doctor. Okay, so how are we going to be able to solve broader social determinants of health? So how are we going to be able to look at these social determinants of health and make sure they don't impact our patients continually, going beyond the one person solution and looking towards more systemic changes? So some possible solutions are increasing diversity in the healthcare workforce. So obviously that's what we're trying to do here with MAPS. Increasing the number of primary care providers, increasing access and affordability of care and insurance, and then improving quality of public health education. So we're going to kind of go into each one of these. So increasing diversity of the healthcare workforce. The goal is to decrease bias and discrimination and improve care, and also reducing distrust for minority patients. And speaking of that distrust, I know, at least from personal experience, I know several people who will just avoid doctors at all costs because they've either gone and had a bad experience, like maybe they brought up something that was going on and it just wasn't addressed at all. Like I was trying to convince my dad to go into the doctor to get some help. And he was saying, the last time I went in, I was telling them how I was having arm pain when I went up like this with my arm. And they just said, don't lift your arm like that. So obviously, when you have bad experiences in healthcare, it makes you not want to go back. And then that kind of makes it hard to get preventative care. And we're going to talk more about the importance of preventative care in a second. So how do we increase the diversity of the healthcare workforce? We want to support minority students who want to work in healthcare. So host things like MAPS. And if once you guys do get into medical school, try to lift as you climb. Don't just say, I made it, good luck to everybody else. Try to support those coming behind you. And then another thing that med schools have tried to do is implement holistic review. So they try to take into account the whole applicant rather than just their numbers, so they can increase diversity a little bit and understand the background of their students. Improving health literacy. Improving health literacy and your understanding of what you can do to improve your health will lead to better lifestyle choices. So understanding why is it important to exercise? Why is it important to eat healthy? Not just why, but also how. So how can I do these things? What if I don't have time to exercise for 2 hours a day? What can I do instead? How can I eat healthier and still feel full? So maybe you'll suggest, eat meals that are higher in fiber, that have less calories, but can still make you feel full. So just increasing our patients' knowledge on their health decisions. And then that will also lead to increased trust in the healthcare system. And that can be done by better messaging. And then improving access to insurance. This is kind of the difficult one because healthcare has to be paid for. So the goal is to reduce the number of uninsured and underinsured Americans. So like we were talking about earlier, uninsured are people who just don't have insurance, and then underinsured people don't have enough insurance to cover their medications, cover their doctor's visits, or they can't cover the copays, which is basically the part that you have to pay after you have care. Shorten lapses in coverage. So people who may be covered may forget or be unable to renew their coverage. So a lot of times people will be in the hospital and they will have to renew their coverage while they're in the hospital. And if they don't have any support system to do that for them, then they may lose coverage. And then that'll create a whole host of other issues. So reducing the cost barrier of medical care is important. And then also increasing access to care. So is there a physician around you? Is there a specialist that you need to see near you? So how could we do that? Obviously decreasing the cost of insurance, and then just educating people on their insurance options and their eligibility. Maybe there's someone who's uninsured who doesn't know, hey, I might meet the eligibility for Medicare or Medicaid. So just helping them figure out what are your options, how can you get insured? Okay, and then a big one is increased access to primary and preventative care. So like we were talking about earlier, people might consistently go to the emergency room when they don't have access to a primary care physician. So we just want to provide consistent access to non-emergent care. And then that'll help decrease emergency room wait times and give increased access to preventative care, which is very important in stopping diseases before you get them, and also stopping the progression of diseases. So how can we do that? We tell future physicians about the importance of primary care. Maybe you're not interested in primary care, and then you find out, oh, primary care is important because it helps people from needing to go to the hospital, from needing surgeries. So really just educating people who are going into healthcare on why we need primary care physicians, and also accelerating the path to practicing. So some med schools have created 3-year programs where instead of getting your medical degree in 4 years, you'll get it in 3 years if you're practicing primary care. And then that also decreased the burden of cost. So primary care is one of the lower paying specialties, which is why a lot of people don't want to go into it. But if you're only going for 3 years, or then obviously that's less tuition you have to pay. Or if you're going to be able to do a program that forgives some of your loans after you graduate medical school and you go into primary care, then that'll be helpful. Or some schools are even doing away with cost of tuition. So those all help funnel more people into primary care and increase access to primary care. So more on preventative care. So basically that's routine checkups that can allow early intervention, which can prevent diseases, and then early detection, which can lead to early treatment and better health outcomes. So cancer screening is a big one. If you don't go to the doctor for a large number of years, and then by the time you finally do go, if they find something wrong, and let's say you do have cancer, it's going to be much easier to treat if you're in an earlier stage than if you're in a later stage. So that's the importance of having consistent access to care. You're able to catch things earlier. So maybe you're able to catch prediabetes before diabetes. Maybe you're able to catch colon cancer or a colon polyp before it becomes colon cancer, because a lot of colon cancers are preventable. So that's kind of the importance of preventative care. Catching things as early as possible, and providing care before things get bad or before there's even a disease. So yeah, and then another thing involved with preventative care is obviously vaccination. So if you get vaccinated before you get a disease, then that's obviously saving you a lot of trouble. And then like we were talking about earlier, patient advocacy is a big one. So this is basically working on behalf of the patient to improve their quality of care. And it can look like a lot of different things. You can be advocating for patients amongst colleagues or supervisors. So if you're, let's say you're a resident, so you're just out of med school, and then you're working with an attending physician, and you see the attending physician is being biased towards a patient, or maybe the patient just isn't really comfortable with the treatment plan that the attending physician has, you can kind of work with them and be a bridge and communicate, hey, I think we should kind of listen to their concerns. Maybe the attending physician would kind of just brush it off and was like, oh, it's nothing, when the patient is obviously in clear pain, and you just kind of echo their concerns and be a second voice. You can advocate in favor of policy reform. So maybe you see the poor health outcomes that uninsured patients have, and you advocate in front of Congress, and you're like, hey, we really need to increase access to insurance. You can also advocate with outside entities like insurance companies. So sometimes insurance companies will refuse to cover medication that a patient needs. So you'll have to get on the phone and talk to them and be like, hey, my patient needs this, blah, 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 blah. So just really advocating for what's best for your patient. I'm sure many of you guys have done it for a loved one or for yourself. Maybe you didn't feel like you were listened to and you had to really stress what's going on, or maybe you felt like a family member wasn't getting the best care, so you kind of had to call things out. So yeah, this is a big one. Obviously, we're trying to get more minority physicians out there, but if we're not intentional with things like patient advocacy, then it's not as beneficial. If we're aware of the biases that our colleagues might have, that we might have, then we can be effective at kind of reducing these health disparities. And then the last bullet point is just kind of humility. Obviously, we make mistakes. If someone is trying to advocate for a patient to you, just kind of being open to hearing what they're saying and taking it all into account. It's hard to advocate if nobody's listening. All right, and then this is just a clip from a documentary that HBO did involving Serena Williams. So a couple years ago, she gave birth to her first child, and she had a lot of complications after she gave birth, and she did a lot to advocate for herself to make sure that she was getting the medical care that she needed, because she wasn't at first, and if she hadn't spoken up, then she may not be here today. So this is a quick video on that.
Little makeup on, so I could take pictures with the baby. And I just remember getting up and I couldn't breathe. And I was like, I can't breathe. Like I couldn't take a deep breath. I told the nurse I can't breathe. I need a mask. So I put the oxygen mask on, and I started coughing because I couldn't breathe. It hurt so bad. It hurt so bad. And then my stitches broke. And I remember I was in the bathroom with my mom, and I was just crying and crying, and she was crying. She was like, "You just gotta breathe." And I was like, I can't breathe. And it was just really hard. After that, I remember being wheeled back to the operating room because they had to reopen my C-section and re-stitch it. And then they had to check for, blood clots and everything. So they were doing all these different tests and everything was negative. I'm like, listen, I need you to run a CAT scan with dye because I have a pulmonary embolism in my lungs. I know it. I know I've had this before. I know my body.
She was undoubtedly battling for her life, and I was terrified that she might die. But I was grateful that she had the wherewithal to speak up because she knew her body better than any of us.
The enormity of everything was scary. Unfortunately, because she advocated for herself, they ended up taking her in for CAT scan and they found pulmonary embolism.
Every day I was in the operating room for something different. It was one thing after another. Eventually, I got another blood clot in my leg. So the decision was going in for third surgery, where they put a filter in me that blocks blood clots from being able to get up to my heart. I was so healthy. My pregnancy was so easy. Like I didn't have any problems, but unfortunately, once I had the C-section, everything from there was pretty much a nightmare.
So yeah, that just kind of underscores the importance of advocating for patients. Let's see. Oh, it's on the next slide. So that kind of underscores the importance of advocating for patients. If it seems like something's wrong and the patient's complaining, make sure that that's heard, whether that just requires you listening to the patient or whether that's you insisting to colleagues, hey, I think we should check this out, because Serena Williams doesn't have a medical degree, but she knew what was going on. And sometimes you'll be wrong, and that's fine. But just listening to patients' concerns, taking them seriously, and then when they're not being taken seriously, kind of advocating for them. So yeah, and then on the, so this is kind of a display of the disparity in pregnancy related deaths, so maternal mortality for Black women. So obviously it's significantly higher for Black women than for other races. And that just goes back into the social determinants of health. So are we listening to Black women when they have complaints, when they're giving birth? They're in pain. Are we listening to them? Are we checking for everything? Are we running all the tests that we need to do? Is it health literacy? Are we giving Black women all the information that we need to provide when they're having birth so they can have a successful and healthy pregnancy? So yeah, these are just all things that you have to take into account when you're acting as a physician, when you're working in the healthcare space, because it's not just every patient is the same. Everyone comes into you and you have to solve the problem. You have to take into account the environment that they're coming from and see how can we mitigate those issues so we can effectively provide care. So yeah, this is just one example of a public health project that's being worked on by OSU. So this is the Black Impact 100, which is in conjunction with the African American Wellness Initiative. So yeah, it's led by Dr. Joseph. And basically they're looking at the social determinants of health and saying, not just, hey, how can we research this? How can we understand it? How can we intervene? Because if we're not taking steps, like if we run a clinic, let's say we go out into the community and we measure everybody's blood pressure. And we're like, okay, this person has hypertension, this person, and we measure everybody's blood glucose as well. This person has hypertension. This person might have diabetes. This person has whatever. It doesn't really matter if we're not doing anything about it. So this isn't just going in and getting those measurements. It's saying, how can we intervene? How can we improve health literacy? How can we help them improve their lifestyles and help them have the tools to just lead healthier lives. So this is just one example that's being done at Ohio State by Dr. Joseph. Dr. Gray has also been involved, and then Dr. Tamai Nolan in the College of Nursing. So this is just one example of how we're going from learning about health disparities to actually taking action in health disparities.
So I actually helped out with the data analysis for Dr. Joseph, and I was really shocked when our past e-board Emanuela, and they were also in his research group, and we went out and saw there's just so much. I was really shocked when I saw the paperwork, and it was all just from Columbus, Ohio, and it's sad because a lot of them didn't know they were already pre-diabetes, and they didn't know where to go from stuff and whatnot. But I just wanted to say that that's stuff that we really need to discuss in our community. And I'm glad that there's already work being done. But that's not enough.
So yeah, your overall goal as a doctor is to help people when they are sick. But we can also do more to prevent people from getting sick. And then also just treating them earlier when they are sick. So that's the overall goal of today's meeting. Just understanding what you can do and then getting your brain thinking on what more can we do to improve health outcomes for underserved communities.
I don't know if they're doing something this year, but they have an annual African American wellness walk.
I think it's on here.
Yeah, and I think when the date's almost close, they ask for volunteers and stuff like that. So it's really amazing to sign up. But we'll let you guys know if you hear any more information.
So yeah, the African American Wellness Walk is, I believe, in August. We'll send out more information. So yeah, if we hear anything else from them on volunteer opportunities, we'll let you know. But this is just one example of projects at Ohio State, and I'm sure we can put together an email of just some other public health projects at Ohio State. So yeah, that's what we have for you today.
Any questions? I know that was a lot.
If not, we'll be around, at least for the next few minutes. But yeah, thank you for everyone for coming out. Thank you for everyone on Zoom, for anyone who's watching the recording. And we'll see you soon.